Broadcasting begins in 3, 2, 1.
Hello, ladies and gentlemen, a very warm and a cuddly welcome to Chai with Vijay Jogia. Cheers. I am Vijay and I'm your host today and I'm logging you guys into the system. Welcome to the show. Now we are live on the Facebook and we are live on the YouTube as well. Now just to clear out a couple of formalities, the purpose of this show is to invite professions and various achievers to come and talk to us about their experience and their knowledge in the areas of their field. Our guests are from all over the world, UK, India, New Zealand, Fiji, and the subjects that we cover span from immigration, law, real estate, Bollywood also, sports, health, wealth, and general affairs, including COVID-19. Furthermore, this program is to provide you information, right? So that means that there is no money exchange here and there are no financial gains by anyone. There is no discrimination or favorism towards or against any individual or any organization. The purpose of this program is to have fun and entertainment. So now, without further delay, I am really excited and really delighted to introduce to you our guest today. Now, this young man is a very well-known personality in Australia, in New Zealand, and in Fiji as well. He was born in Fiji. He studied in New Zealand and is now working here in Sydney. So he's been in this dentistry business for the last 35 years. So without any further wasting any further time, I am delighted to welcome Dr. Anil Kumar. Dr. Anil Kumar, welcome to the show.
विजय जोगिया भाई बहुत शुक्रिया बहुत धन्यवाद thank you very much for inviting me. I have the privilege of and honor of being your guest tonight. Namaste, Sat Sri Akal, Nisambola, and Salam Alaikum to and Kia Ora to our New Zealand friends, to all our listeners. Thank you, and I'm looking forward to this program, Vijay bhai. Thank you.
And I really thank you for your time. Let's go straight into, tell us about yourself. I briefly mentioned what happened, but if you can elaborate on that for our viewers, please.
Sure, Vijay bhai. Well, I'm a dental surgeon. In fact, this is my 40th year as a dentist, Vijay bhai.
Wow.
I graduated on the 12th of December 1980 from the Otago Dental School in Dunedin in the South Island of New Zealand. And basically, my 40th anniversary is coming up, so I expect some chai from you, Bhai Sahab. So I was born on the Garden Island of Fiji in New Zealand. It's called Taveuni. It's actually the third largest island, and it boasts a very unique flower called the Tangimodia, which only flowers once a year. So you can Google all this. So Tavyuni is known as the garden island. Everything grows big there. It's very fertile. I moved to Suva. My parents brought me to Suva for the usual reasons that most Indians do, which is for education and a better future. So I moved to Fiji, to Suva from Tavyuni, my birthplace, when I was 6 years old. So I did my primary and secondary education in Suva, very well known high school in Suva called Maris Brothers High School. That was it's an all boys school. It's a Catholic school, and my primary schooling was at Holy Trinity Primary. Then I quickly went on to the USP. I got a scholarship because in Fiji in those days the school ended in about a year 11 standard, which is Form 6. We did not have a year 12 Form 7 equivalent. So I got a scholarship, did 1 year at the university, and then I got a scholarship to go to New Zealand. So someone upstairs was kind to me, looking after me.
Well, it's very kind, and obviously you are working really hard to. Tell me, dentistry. Did anybody force you to do dentistry, or it was you? I want to do dentistry.
I was always interested in science, Vijay. From the time I was in Form 3, which is like a year 10, I enjoyed chemistry, science, biology. And then by the time I was in year 11, I do have quite a few doctors, nurses, and one dentist in the family who is now deceased, my mama. Dr. Bernard Vijay Kumar, God bless his soul. So basically, I was drawn into the healing and the health sciences. I was fascinated about how the body works. And basically, I got a scholarship to go into in those days, we had very few choices, Vijay Bhai. आजकल तरह नहीं है कि you do one course after a year at uni, you change and you chop and change. There are many opportunities, and sometimes people change from one course to the other twice within the university career. In our day, एक ही जहाज था. Once you're on the ship, it's no going back.
There's no going back. So, what is 40 years in the industry, which is remarkable.
On December the 12th, 12th of December this year is my 40th anniversary since I graduated with my first degree, sir.
Wow, excellent. And you also have studied in UK for the...
Bhai. Well, I got another scholarship in 1984 August to go back to New Zealand, my alma mater, my university, to do a master's. So again, I was lucky. I was the first Indo-Fiji. In fact, I was the very first Fiji-born person to complete a master's degree in dentistry. So yeah, I was very fortunate, and I thank the Almighty for the opportunity to learn. So that was a 3-year course to do a master's, and then I took a flight, 22-hour flight from Melbourne to Heathrow Airport, went to London, then to Glasgow for another 6 months of further study in the cold.
Oh yeah, I like Glasgow. Pretty good, but pretty cold. Right. Now, during this time, obviously you are a lot younger comparatively, right? Did you come across any obstacles, any major problems?
I think in our era, we had an obstacle every year, which meant that we really had to pass an exam to go further on and further on. So our first exam in Fiji was in year 8. It's called an entrance to the high school. If you don't pass that, it is very difficult to go on to high school. So at high school in Form 4, which is almost the equivalent of a year 10, you had to do another exam called the Fiji Junior exam. So I did my Fiji Junior in 1972, and those Indo-Fijians listening who are in my age bracket will remember the terrifying Hurricane Bibi, which came in 1972, and we have a very famous dancer called Hurricane Bibi. आप उससे side मिले होंगे.
I do know about that one. Yes.
So she's named after him. So this is the real hurricane. So then year 10, Form 4, you have to pass another exam to go further ahead. Then in Form 5, you do a New Zealand school certificate. Then if you pass that, then and only then do you progress to Form 6. And if you pass that, then you go to the university foundation, and then on from there to any degree course or medicine or dentistry. So we had hurdles every year. If you didn't pass, you repeated the year. or you just merely left school.
Right. So now let's get into the actual dentistry. What type of services do you and your colleagues provide right now?
Okay, dentistry is a healing art. It is a science. It is an art, and it is also for senior dentists like me. It becomes a hobby. Like musicians, it becomes more of a hobby than like a profession, because we've got a lot of experience. So dentistry has changed remarkably since I graduated. Of course, we did not have any computers or iPhones or tablets or laptops. Everything was written by hand when I was a student, and in the first sort of 10 years of my career from 1980 to 1990. As we all know, IT changed and develops kind of late 1980s and to the early 1990s, right? And then we could start doing things on the computer, and we did not have the internet until, I don't know, something like 90 something. So
Yeah.
everything was manual, so very time consuming. We could not learn at the press of a button. For instance, if somebody wants to know how many bones in the human skull, you just go and Google it, and it'll tell you that there are 22 bones in the human skull.
Hmm.
We had to go to the library, search, sit in a lecture theater. So studying was very, very laborious. To do an assignment, it took us like we were given 2 weeks to do an assignment, because we had to go to journals manually. Now people sit in their bedroom, students, with a cup of Milo, and do their assignment in the comfort of their bed.
That is correct. Yes. Which is also good. Um, However, so the technology has changed.
Extremely changed. Like, for example, we can do x-rays, digital x-rays. So once we have a sensor, which is like an SD card, glorified SD card, CMC sensor, we put it in the mouth with infection control and all that in mind. We can have an x-ray picture on our laptop within 15 seconds of the time we put the sensor in the mouth and expose the x-ray.
Wow.
So basically, we can have a reasonably good diagnosis from the time we press the button to expose the X-ray to the digital sensor that's sent by a cable or wirelessly to the laptop, and within a minute, we can have a picture and say, "Oh, we can make a reasonable diagnosis in under 2 minutes."
Wow, that's really super. I remember when I was young, way back in UK, and I went for my first dentistry examination, right? And the dentist asked me, "Are you allergic to anything?" I said, "No, I'm not." And he put an injection, and guess what happened? I fainted,
Yeah.
literally fainted. So
Okay.
those were the tough days compared to
Mm,
when you go
mm,
now, and
mm.
she's just putting in, or you are putting in so many injections,
Yes.
and nothing happens.
Yeah,
So
that's
how?
the sorry to butt in, Faisal. There's various reasons for that. I mean, one reason is technology again. In the days you're talking about, maybe 1960s and 70s, the needles were reused. They were
Okay.
re-sterilized. Sometimes they had to be sharpened, same as you sharpen your nails. And nowadays, everything is single use. The needles are very thin, about 27 to 30 gauge. They are tri-beveled, and they have a silicon coating. You can actually see it, and it slips through the tissues like a hot knife through butter. Very changed technology.
Yeah, and normally um, people are nervous when
Mm,
visiting dentists, right?
mm,
You'll
mm,
agree.
mm. Yeah.
They're scared and they're nervous. I'm one of them, so I'm
Mm,
talking for lots of people.
mm.
Yeah.
Yes, yes.
Um, so how do you personally manage that situation? How do you calm them
Okay.
down?
Okay. Now, my patients know what my technique is, but I will cover very quickly, if I can, within 30 seconds, of how you calm that. One is through drugs, sedatives, and anti-depressant medication we can give people. We can use nitrous oxide and oxygen, which is a gas mixture which allays anxiety. So there's drugs, there's gases, there's tablets, mood changing. Very nervous patients, they can have an injection in the arm. It's called intravenous sedation.
Hmm.
Twilight sleep. You're not asleep. You can hear us. You can, if Vijay Bhai is singing, you'll hear him singing, but you're not completely knocked out. And then very, very advanced procedures, surgery, then you're knocked out, a full general anesthetic. And there's two other forms of non-pharmacological, non-drug way of calming people down. And one of them is what aap aur hum abhi kar rahe hain, which is earphone music. So we encourage people to bring their music, listen to the music while we're treating them. And or you can have someone like myself, we just keep talking and sometimes hum a few tunes and calm the patient down. Some
Right.
people like
Okay.
it, some people don't like it.
Yes, yes. We'll come to that. And going back to what main services do you offer?
Well, my main area of expertise, my master's was in the field of oral surgery. So that's operations in and around the mouth, diagnosing cysts and tumors and fractures. So I've done a lot of work treating a lot of broken jaws. In private practice in Australia, we are unable to do that because you need to be admitted in a hospital to do a lot of major surgery, and it has to be done by a maxillofacial surgeon. So nowadays, if you want to be a maxillofacial surgeon, you have to have a dual qualification. You have to be trained as a dentist as well as a medical doctor. So BDS and MBBS Munnabai both.
Okay, all right.
To be a surgeon.
That's quite difficult, but people do it like yourself. So
Yes.
we are very fortunate to have you do that.
So I didn't do a medical degree. In those days, you only needed was to a higher degree. But with the changing, horizon in surgery and advancement, you need to be doubly qualified now. So everybody else coming in after my lot, you need to be duly qualified.
Yeah, and dental hygiene you mentioned, or oral hygiene. That's very important, isn't it?
Well, personal hygiene, of course, culturally, in our culture, in the Arab world, Middle East, India, Pakistan, hygiene is tagged on with culture. We've always experienced and practiced hygiene, right? Sabhi mazhab mein haath dhona hai, face dhona hai, feet. I remember my mother used to say, if you're playing outside, wash your hands, face and feet before coming in the house. We all like balti ka pani tha outside near the door.
Acha.
Even if you're a shower, so it's kind of a cultural thing, awareness, experience, and also just the personal self-esteem of people. No? They want to look good, they want to feel good, they want to smell good. So
Sure.
same with the mouth. If you're within half a meter of a person who has gum disease, वो थोड़ा smell आएगा, and then some people don't realize it that they actually have, which is the commonest problem in the mouth, which is gum disease.
Then how do you explain that to your patients? Do you just go and tell them, or?
There's three ways of telling them. One is professionally. If a person comes in and they're in the chair, we show them I have a camera. Most dentists have a camera, so we go around and we scan, and they can see on the screen the inside of the mouth. Yeah. So the mouth, they can actually see live. I said this ye hai na. So 1-to-1. Secondly, team, like if somebody goes to a prenatal clinic and a lady is expecting, they normally have prenatal clinics where the mothers to be are taught about oral hygiene, the ill effects on their health. And the other one is basically just general awareness, Yeah, obviously I wouldn't walk up to a guy in a concert and tell him that, look, you have gum disease, So,
We don't want to do that. Sometimes, or many a times, you must be getting some patients who are kind of, difficult to deal with. Is
yes,
that
difficult.
happen?
Oh, yes, difficult or even impossible. For example, once a month, as you know, we are both in the entertainment industry. Someone at 1 a.m. will approach me at a function and say, "Oh, doc," he said, "you're a dentist." He said, "ये दांत देखा है, इसको क्या कर सकेंगे?" So I have to give an on-the-spot, quick, provisional diagnosis. Oh, I think you need a crown, or oh, looks like a wisdom tooth. I said, but you need to come in and do that. So difficult patients, basically based on, again, a lot of factors. Sometimes we have disputes about fees. Fees vary for every profession. You can pay $4 in my suburb for fish and chips. If you go to Rockdale's, it's twice the fee. $8, right? So it's like real estate. So fees, disputes, people are anxious. There's a trust component as well, confidence, and sometimes we have patients who may not agree with the diagnosis. Yeah, nowadays it's easy. I have an iPad at work dedicated to the patients. So you and I are on the iPad right now. I have another one, and I say, "Bhai, this is your band iPad. Just Google this quickly." And you know what? Vijay Bhai? Nowadays, I have noticed, especially in the past 5 to 10 years, most patients, medical and dental, are quite aware of their condition before they visit the dentist or the doctor.
Okay, they've done the research.
They've done the research, yeah. They know, and they've gone on there. And so that is why a modern dentist, obviously like any profession, we have to be quite aware of what we're talking about, the latest research, the latest material, componentry, because it is possible, and I have noticed that with some of my patients and my colleagues, there might be a chance where the patient might actually know a little bit more than the practitioner.
Yeah.
Possible.
Yeah, that's quite.
The research side.
Yeah, and that is the case with all the other professions
Yes.
also.
Yeah. Yes.
Let's move on and talk about today. What are the main like 2 or 3 or 5 issues that are that the dentistry industry is facing right now?
Everybody's suffering from COVID, so everybody has been made aware of infection control, the importance of contact, wearing PPE. जो लोग जानते नहीं थे PPE क्या, everybody knows personal protective equipment. The whole world knows.
Yes.
We have become aware. Of course, we are dealing with blood and saliva with each and every patient, 99% of the time, whereas a doctor or other health practitioners may not. So it is a fact that a dentist gives more injections, the average dentist, than an average doctor, unless the doctor is based in a hospital. So a GP dentist does more injections and invasive procedures than a GP medical doctor. So of course you have to be aware about touching and spreading and all that. And by the way, no patient has ever caught COVID from a dental surgery yet in Australia.
Oh, thank God for that.
That's
really
a
good.
fact.
Yeah, that's a fact. Yes. So, have you been working like recently? Have you started, or what are your? In which step are you?
We were working right through. We have 5 stages of regulation with our dental board and dental council. So we're level 1, 2, 3, 4, 5. So we were up to level 3, where we were limited to what we could do, pain relief only. So I was still going to work every second day, every third day to do pain relief. So now we're pretty much back to almost normal.
Did you have any emergencies during the lockdown stage?
We had emergencies every day, and that's what we were attending to.
Okay.
So dental emergency basically involves if somebody is bleeding, or they're in severe pain, or they break their jaw, or there's a fracture, toothache, or an infection, swelling, or with specialists if somebody has oral cancer. So in a general dental setting, it basically deals with most of the time with pain and infection.
Right. So so what's the plan now? So you said you'll be starting very, very soon, full time.
I have been working right through. We never stopped.
You never stopped. Okay.
Yeah, we were only doing 2 or 3 patients every second day, only pain relief. So anything that generated an aerosol,
Right.
we were not allowed to do any procedures.
Yes.
Because
Okay.
that disperses particles in the air, virus, bacteria, whatever. And as you know, even if you sneeze, it goes to 1 or 2 meters. So our aerosol machines also disperse fluid and liquid droplets suspended in the air, and that can spread any virus.
So apart from COVID-19, are there any major issues that you will face in a short time or future?
Well, we had the SARS epidemic, then we had the HIV epidemic, the AIDS one. Basically, a dentist treats every patient as if they are potentially carrying a pathogen. It's called a universal precaution.
Yeah.
With COVID, we've been taking extra precaution because it's such a potent, novel virus. It's only a small thing, it's only about 120, 150 to 200 nanometers big. nanometer being 1,000th of a micron, and a micron being one, 1,000th of a millimeter. So anyway, it's a very small virus, but very, very infective, highly infectious. So that's why if you get it on your fingers, hands, any object, even when you're going to the vegetable shop, it comes with you. You touch your eyes, nose, or mouth, it'll get into your throat, then into your lungs. So.
Okay. In terms of any messages, would you like to give any message to the listeners, your patients here, about COVID-19?
Well, I don't think the COVID epidemic is going to be over very shortly. We heard in the news today that in one school there were two students, they had to send
today.
home. So basically, I think it's going to be a roll-on effect for the next 3 to 6 months still.
It is not going to
Yeah,
go straight away.
worldwide. If we level the curve in Australia, and people coming in from overseas, I think they still need to be quarantined.
Yes.
Same protocol, because you just need one person, domino effect.
It is, yeah, and I personally I'm scared that they've done this slightly. I told this earlier on. They've just they are just releasing it a bit too early. Let's hope that I'm wrong and these guys are right. But
Yeah,
I mean,
I agree with you. I think we are a little bit too a little bit too premature in opening things up. And it's said that things are driven by politics and the economy rather than by realism. That's a
and
fact
I'm
of the
sure
world we live in.
I'm pretty sure the PM and the rest of his crew are doing a fantastic job, and we've come out really good so far in this unfortunate circumstances. Any message that you like to give to your patients or generally everybody with regards to oral health?
Yes, sure. I think we are living in a lucky country. Our health system is very, very advanced, and our leaders are doing their level best, as you said. So we need to follow the rules, the regulation, the laws, the protocols. Take it seriously. I mean, I've seen people not social distancing in many, many circumstances. They think it's all over and it's become complacent. Oral hygiene, obviously, if you go home, it's a good idea that if you think you might be working in a susceptible environment, especially health workers, be careful, wash your hands, face, shower as soon as you go home. We use mostly disposable things, but clothing, throw it into the washing machine every day.
Every day, okay.
If
Anything else
you're a health worker, right? So
Right.
you might be touching your hands, masks, and all that, but all you need is a few particles on yourself. But generally, just follow the normal rules: washing hands, soap, water,
Keep distance.
use distancing, your sanitizer. The protocol, the etiquette with sneezing and coughing, and I think should be fine.
Now, on a lighter note, I see a guitar behind you there.
Oh, yes,
And
yeah.
and I understand that you've taken playing guitar already. Now, when do you get time to do all that stuff? I know you are a good singer.
नहीं भाई, आप भी बहुत अच्छा है. I mean, you're a very experienced international singer, and it's good to be in the same scene with the people like yourself, leaders in the field. We appreciate your 2 decades of contribution to Sydney, 25 years.
25 years, yeah.
So
Time flies, yeah.
when time flies. So I took up tabla, and then I learned tabla for 2 or 3 years, and then I said, look, a guitar is very versatile. I always wanted to have the guitar kahin par function party ho, people singing along. It's a good instrument. It gives you melody and rhythm, and people like singing along. You can't carry your piano around with you, but a guitar you put in a bag and you run around. So yeah, I've been concentrating. Time-wise, I think most people who know me, I'm a night owl. I still sleep 6 hours a night. I normally start doing, at the moment, if I was not aapse baat nahi hoti, to I would be learning a few chords and songs from the internet, from YouTube. It's quite easy once you learn the basics.
Yes, yes. I really thank you for coming, Doctor, to take out your time and
Anytime.
discussing all these all these things with us. I would like you to come back again in future and tell us
Yes.
any updates on lots of things that will happen.
Sure thing.
Would you want to say anything to your our audience?
Yes, I think during the lockdown, people have had a lot of time. They've had a lot of soul searching. People have found a lot of things, Vijay Bhai. Right? So, philosophically speaking, some people have found themselves,
Yes,
what
yes,
they are. What are we
yes.
doing in this sansar? What is our aim? Some people have found Bhagwan,
Oh,
the Lord,
yes,
whoever or whatever they, beseech the Almighty to be in their own mazhab. They said, look, soul searching, there is a power out there. Humans can't do anything in some circumstances, and this is a wake up call for all humans. So people have found the family. Some people haven't spoken or met up or had interacted. And what we're doing now through technology, people are talking to people in London and Bihar and my
yes, yes.
sister in there. So we are finding a lot of things. I
Mm.
have really improved my guitar because I have had plenty of time. So every day I try and learn one song from the YouTube, the chords of it. So
Yes,
I try to, if I miss one day, then second day. So it has improved my music. Some people, they like gardening. I have a green thumb. I like to do gardening. Some people doing sewing, others doing recording like yourself. You're a stage and recording artist. I'm sure you've been doing a lot of
a lot of
improvement in
singing.
wrong or singing and recording. So I would say that if you do have time, do some soul searching, meditation, thinking about the future,
Mhm.
and never to be complacent. Anything can happen
Yes.
overnight.
Okay, Doc, I really, really thank you again. Now, sadly, all good things have to end, and we have come to the end of the show. Chai with Vijay Jogia. I hope you guys enjoyed it. And I thank Dr. Anil Kumar, the dental surgeon from Sydney. I enjoyed the time with you. Thank you, doctor, and thank you, audience across the world, for watching us. I have a small invitation for people across. If you want to come and share your professional experience with us, please drop me a line and we'll arrange you to come here and be with us and talk to the world through this beautiful platform that we have. Thank God to Facebook, YouTube, and lots of other multimedia.
IT technology, yes.
IT, yes.
So next time we can maybe do a bit of singing when you come on. You and I will do a bit of live singing.
Okay, you got a
Yeah.
deal. We will do that.
Mm-hmm. I can play the guitar and आप गाएंगे. So it'll be a
Yes,
new
yes.
interaction.
Okay, we will do that, Doc. Thank you so much. And that's it for now. I'm Vijay Jogia and I'm logging you out from the system. But
Yeah.
before I go, it's good night from the doctor. Good night, Doc.
Vijay Jogia bhai, I appreciate what you're doing, your effort, your hobby. As you said, there's no money involved. We're just sharing and trying to interact with our fellow human beings. And I pray that you have good health and keep the motivation up to continue doing what you're doing completely pro bono. No charge, no
When
money exchange.
when I have people like yourself and other professionals coming down, that helps us. And you guys have been really good. This is
So,
our almost 10th episode, so which is not bad.
congratulations.
Thank you so
Congratulations.
much,
Thank
and
you,
we
Vijay
will
bhai.
quickly log off. And that's
My screen says live. Off कर दूं?